Thank you for giving me the opportunity to present our study about the 24-month clinical immuno-virological outcomes and HIV status disclosure in adolescents living with perinatally-acquired HIV in the IeDEA-COHADO cohort in Togo and Côte d'Ivoire from 2015 to 2017. Globally, almost 2 million adolescents were living with HIV in 2019, of which 90% were in sub-Saharan Africa. The adolescents living with perinatally acquired HIV face poor outcomes related to many factors, including lack of timely HIV disclosure of their serostatus. Previous studies have shown that a large proportion of AP-HIV remain unaware of their own HIV positive status, and this despite the WHO recommendation to complete disclosure at the age of 12 and the benefit of timely HIV disclosure. So, this study is aimed to better document the HIV disclosure frequency and process over 24 months of follow-up and to assess the association of HIV disclosure with the 24-month favorable outcomes among AP-HIV since their inclusion in the IeDEA-COHADO cohort. To achieve this objective, we conducted a pilot prophylactic study, included adolescents living with perinatally acquired HIV in Lomé and Abidjan, aged 10 to 19 years old, who consented with their parents to participate in the study, and who were included in HIV care before the age of 10 years. These adolescents were followed 6 monthly over 24 months. The main variables were HIV disclosure, and our evaluation criteria were a combined 24-month outcome, defined favorable when at least occurred death or progression to AIDS clinical stage, CD4 counts decreased above 10% compared to baseline, viral load were detectable, or adolescents were lost to follow-up. Adolescents with none of the above criteria were classified with a favorable outcome. For the analysis, we described baseline follow-up and 24-month data, and we investigated correlates of 24-month favorable combined outcome using a logistic regression. What we found at inclusion in the left of the slide, 209 adolescents were included, of whom 55% were female. Overall, 42% adolescents were full HIV disclosed, significantly more in Abidjan compared to Lomé. Adolescents were significantly older and treated for a long time in Abidjan compared to Lomé. At 24 months, 74 adolescents were fully HIV disclosed, more disclosed in Lomé during the study than in Abidjan. 3% adolescents died. Overall, 45% adolescents had favorable 24-month combined outcome, significantly more in Lomé than in Abidjan. Here is the multivariate analysis. Adjusted to sex, pipette drinking water access, environment, and being orphan variables, being HIV disclosed for more than 2 years in Lomé significantly reduced the probability of having a favorable outcome compared to those not disclosed. This association was not significant in Abidjan. At the end of this IeDEA-COHADO study, we found that HIV disclosure increased over the study period, which is probably explained by cohort effect as adolescents grew up, and also by the 3-day training workshop on HIV serostatus disclosure delivered in 2016 to health professionals in Abidjan. The association between HIV disclosure with a favorable outcome observed in Lomé was not causal. HIV disclosure was rather the marker of an advanced HIV disease that have prompted the disclosure process. Our findings highlight the difference of historical care practices and resources available between two West African cities that must be taken into consideration to adapt AP-HIV care delivery. Thank you for your attention. Thank you to families, IeDEA investigators, and funders. Thank you for your attention.